Cleveland Pain Care is a private practice. We specialize in non-opioid pain management. Our goal is to help our patients achieve a state of wellness, improve functioning, and reduce pain. Opioid medication probably is not the ideal way to treat chronic pain. Pain that persists for a period of time, meaning months or even years in some cases, unfortunately, after an injury has occurred. And using opiates to manage pain in that way tends to probably make pain worse over time, primarily because the body develops a tolerance to the effects of opiates, and simultaneously a patient can become sort of dependent on the medication, and then they kind of end up chasing their tail with their practitioner or their provider because one of the symptoms of withdrawal from opiates is pain. So you don't even know if it's the pain you initially had that's causing problems, or it's pain from the actual opiate medication that's causing the pain or the problem.
Let's leave that one up.
We treat patients with medications that are non-opiate based. We have injection therapy that we do, which are various types of spinal blocks, peripheral joint injections. So people who have arthritis, we can sometimes inject different types of medications into the joints. These things can include everything from numbing medications or anesthetics to different types of steroids. We also use things like stem cell therapy, which is kind of a cutting-edge treatment to approach tissue damage or areas of pain. We can basically take an individual stem cells, harvest them, which means basically just extract them from the bones, and then kind of concentrate them and then re-inject them into areas where there's tissue damage to try to promote healing and tissue regeneration. We've had some people who will have a stem cell injection and they're like 100% better. We've had other people where, they have 50% reduction in pain. Some people need more than one stem cell injection. Everybody's different and you have to take it case by case. One of the challenges with stem cell therapy is that we're still learning so much about it, and it's really an experimental procedure. This is an example of the battery. It's very small. For very specific select patients who are not getting better with medication management, therapies, they're not surgical candidates. They sort of really exhausted the realm of possibilities in terms of treatment options. We have a medical device that we can actually surgically implant, which can help kind of sort of manage chronic pain conditions, various types of chronic pain conditions. This is something known as a spinal cord stimulator. It's an internal pacemaker that, rather than regulating your heartbeat and your heart rate, it helps you manage and regulate your pain response. As an interventional pain management physician, we are sort of a bridge between the medical and the surgical world. So oftentimes, when it's appropriate, we can help people avoid surgery. We can help people avoid medications. We work very closely with surgeons and physical therapists, and all of it is in the spirit of trying to help people get well, improve functioning, and improve their overall pain, and to avoid this sort of process where people become inherently dependent on medications and their physicians.